A Kent patient with the blood disorder sickle cell anemia says he feels as if he's being tortured every time he's rushed to accident and emergency because doctors fail to give him adequate pain relief. John Griffiths from Ebbsfleet near Gravesend says he's often forced to call his family for help because he's left suffering excruciating pain. The Dartford and Gravesham NHS Trust has apologised for failings in his care and the added distress they've caused. Our special correspondent Colin Campbell has this exclusive report.
To me, it feels like a consistent throbbing pain, but it's an excruciating, extreme throbbing pain that kind of just rips through your whole body.
John has sickle cell anemia, a hereditary condition which causes agonising and debilitating pain attacks. At home, he uses prescribed drugs to try to quell the pain.
These are slow-release morphine tablets.
When the pain's unbearable, he has to be rushed to Darrenth Valley Hospital. But when he reaches A&E, he says he's often left suffering in agony.
It's just sad that I have to ring people outside of hospital, and it's very fortunate that I have a good family around me, that I have to ring people to get them to call up to try and amend what's not being done. And it's really sad for me. It's sad. It's sad for me, and I feel sad for others that have to go through that.
Sickle cell anemia is a disorder of the haemoglobin in red blood cells that carry oxygen around the body. When the blood cells lose oxygen and change shape, they stick together and block small blood vessels. This causes severe pain, known as a sickle cell crisis.
There's times where I just can't speak and I'm just laying there, and I know that I need to speak to try and get through to these people what I need, but there's times where I just can't get up and I can't even move my head. So it feels almost like I'm just extremely vulnerable, and it brings me to a place really where I'm quite on my knees.
John has a care plan which lists the pain relief he's supposed to receive in hospital during a sickle cell crisis. You all right?
Yeah, cheers, thanks, Colin. Cheers, mate.
But he says he's left feeling extreme pain because he says the plan is never adhered to.
I've seen him cry, scream, roll around on the floor, and gradually it's just getting worse.
His wife Jen, who's expecting their second child, is urging Dartford and Gravesham NHS Trust to better educate its staff about sickle cell anemia.
He's on the phone saying, please help, we can't go in, they're not answering their phones. It's torture, it is torture.
Despite complaints spanning 5 years, John says A&E staff are still failing to provide him with the pain relief he needs. In May, Dartford and Gravesham NHS Trust apologised for his care plan not being adhered to and for the added distress it causes, adding emergency department clinicians will work with him and take advice from their sickle cell lead to make sure they can create a suitable plan adaptable to the challenges of managing his condition.
Sickle cell is all about pain, and it's a medical emergency. And what that means is that it's a designation just like a stroke or a heart attack, and substandard or poor care can certainly lead to a person's death.
2 years ago, Evan Nathan Smith became so desperate he rang 999 from his London hospital bed after being refused oxygen in the midst of a sickle cell crisis. The 21-year-old died of complications 2 days later. A coroner said there was a lack of understanding about sickle cell disease amongst those looking after Mr. Smith, and he would not have died if offered a blood transfusion sooner.
I'm so fortunate. That's the most fortunate thing, that I'm blessed with such great family that are always there at the drop of a hat. So they are basically like my 999.
To help him get on with his life and battle the disease with dignity, John is pleading for medics to stick to his hospital care plan and provide him with the right level of pain relief when required. Colin Campbell, BBC South East Today, Ebbsfleet.
Well, Chrissy Reedy's also been following the story. Very distressing scenes there, Chrissy. Where are things going wrong?
It's desperately sad, Ellie. When you listen to experiences from the likes of John, it really does seem to come down to a lack of understanding on the part of medical staff in A&E units. Like he said, he's been to A&E, 4 or 5 times, but every time he gets there, it's like they've never seen him before. Sadly, it is a common problem. There doesn't appear to be enough knowledgeable healthcare professionals, and there's still very little public awareness. Now, this is a blood condition. It affects around 15,000 people in the UK. It's understood to be the country's fastest growing blood condition, but it does seem that there really is a need for more training and more understanding about when people are having what's called a sickle cell crisis, the severity of the pain, that people really do understand that. One person described it as having a tractor go over them. So progress is slow, and there are regional differences, but to quote the Sickle Cell Society, they said there is no excuse for leaving patients in pain.
Indeed, Chrissy. Thank you very much.